Greetings, everybody, and welcome to my Lupus Living Room. My name is Suzanne Tierney, and I am the CEO and president of the Lupus Foundation of America's Great Ohio Chapter, and I have lupus. And a lot of conversation has been going on lately about Medicare. The fall is coming up, and there's all these deadlines and changes that are going to be going on. So I think we need to have a lot of questions answered, and we need to know the changes. And as many of you, as myself, I am on Medicare. So we have a wonderful guest today that joined us. Her name is Becky Hayward. She's from OSHIIP, and she's going to explain what that is. And I'm just so delighted to have you, and I apologize for the technical challenges we had a few minutes ago. But Becky, welcome to my living room. I'm really excited that you're able to take the time to join us today, and I am totally ignorant about any changes going on. So, you're going to unload on me, and hopefully we'll share it with everyone else who is as ignorant as I am. Okay? So, Becky, who are you? What do you do? How do you do it? What's going on?
Great. Thanks, Suzanne, for having us today. I work, and you did a great job. It's OSHIIP with a very careful P, right? Right. It's the Ohio Senior Health Insurance Information Program. So we are based out of Columbus at the Ohio Department of Insurance, but we are a network of SHIPs. So every state has a federal SHIP program like us. We get federal dollars to provide free, objective, unbiased Medicare information and assistance for people on Medicare and their caregivers. So obviously we're here for Ohio, but every state has a similar program with that same mission. So my favorite part when I tell people what I do for Medicare or how I help with Medicare is I'm not here selling anything. We're not insurance agents. We don't work for insurance companies. We are strictly a resource so people can understand what Medicare is, how they get their Medicare benefits, how it works, if there's issues that come up. That's what we do all year long.
How does anybody know? I'm one of those senior citizens right now, and I struggle with the world of technology. I mean, I do okay, but I know a lot of people my age that have very little knowledge of all the stuff that's going on. How would someone know about you? I mean, who refers people to you? I mean, you came to me from our nurse that we have here, our head patient navigator, Rita. And it was like, how would I know who OSHIIP is? I wouldn't even know this.
I'm not sure how Rita found us, but I think it was through a virtual counseling appointment that she set up through our program. So we have a hotline. So we do have a call toll-free hotline that's available Monday through Friday, 7:30 to 5. That's Columbus for Ohio. Real people. Somebody asked, are they AI? No, they're real people based in Central Ohio. And then we also do virtual counseling appointments, something similar to what you and I are doing. And I think that's how Rita found us, doing it that way, and then happened to mention, hey, would you do this podcast? So how do we get the word out? I feel like, we've been around for over 35 years.
Wow.
Yeah.
Wow.
So OSHIIP has been here for over 35 years in the Department of Insurance. I feel like we're out there every day trying to promote our information and that we're here as a resource, but so many people don't know we're here. One of the biggest ways is, and I don't know if it'll work, so everybody gets a Medicare and You book.
Yes.
If you're on Medicare, we're in here. We're actually
I'm supposed to read. Wait, I'm supposed to read that.
We're actually
that whole book.
Right. We're actually on the back of the book. So a lot of people find us that way, off the back of their book. Or maybe they get other health, and they get their Medicare health insurance through different programs who promote the SHIP that way by saying, hey, you should contact your local SHIP. And that's who we are. They might get through to us through 1-800-Medicare. They call that toll-free. That's a national. And they might say, hey, you need some local help. We use a lot of our partners and resources through area agencies on aging, Social Security Administration, Rita, They're always looking for resources. Your navigators
Mm-hmm.
would be looking for resources.
Mm-hmm.
And just trying to get the word out that we're here. There's lots of insurance agents and brokers and insurance companies who promote and try to get people to contact them. And some of them will refer them to us too, but we are strictly here we are not insurance. We are supposed to be here to help you objectively and unbiasedly through your Medicare program.
Okay, so what can we learn today? What's going on? Changes.
So when I talk about Medicare, and I'll do it with you, Suzanne, if I'm in a room with folks, I'll ask people if they have Medicare, and they'll raise their hand and say, yeah, I have Medicare. And I always follow it up with a second question. Do you know how you get your Medicare health insurance? And people look at me funny. What are the cards in your wallet that you use to get your Medicare health insurance? We all have some type of insurance card that we use. Maybe we use our red, white, and blue traditional, old-fashioned, somebody called it, Medicare as our primary insurance. That's what we show at the doctors and the hospital. And then maybe we have some kind of second card or second insurance that works with Medicare, that red, white, and blue Medicare, to pay all of my claims. And then you might even have a third card that you use at the prescription drug at the pharmacy to pick up prescription drugs. So that is one option that people get their
Mm-hmm.
Medicare. The other option, and it's always an or, it's not a combination of the two, it's an or, somebody replaces that red, white, and blue Medicare card with a Medicare Advantage or a managed health plan or a Part C if you want to go that way. So that is the card they use for everything. So really, anybody who is on Medicare first needs to know which way, how they're getting their Medicare. And then once you understand how you get your Medicare and you review those options, those coverage, that costs, all of that, then you understand whether you need to do anything when we come around to this Medicare open enrollment that comes around every year in the fall.
So why does it come around every year? You would think once you're on Medicare that you're in. Why can't it be grandfathered in? Why do I have to review it every year?
So the Medicare open enrollment is for reviewing, for changing, dropping, or enrolling into Medicare prescription drug Part D plans, or changing, enrolling, or dropping your Medicare Advantage plan. For if you just have regular red, white, and blue Medicare, you're not changing that choice, or you have the option to change the Medicare Advantage. So when they created Part D, they being the federal government, Medicare is a law, so it has to be passed by our friends in D.C., right? So they passed the law in 2003. It became effective in 2006 that created Medicare open enrollment. What it did was made Part D, so it gave people prescription drug insurance. It reevaluated the Part C of the program, which is now what we call Medicare Advantage, and it created this open enrollment period because these plans have a one-year contract with the government to provide this health insurance. So then they thought that Medicare beneficiaries should also have a one-year opportunity to make any changes that they want to. So that enrollment's here to shop for Part D or Medicare Advantage. You don't have to, but I always say it's really a good time to clean out your wallet too, because maybe you're carrying all kinds of insurance cards that you really don't
Mm-hmm.
need. So it's a nice reminder, one, to figure out what you have, clean out that wallet, and then I often tell people share it with somebody you love or share it with somebody who is assisting you so they understand as well. It's not a bad thing to review our insurance every year. We do it for our employers as well. Um, but it is something that was created in 2006.
So we have the regular Medicare, and then we have the supplement and a prescription. Is that pretty the basic way that this works, or can you get all of this under a Medicare Advantage plan?
That you just said it exactly right. You can
Oh,
get it one way, that Medicare, the supplement, and the
okay,
prescription, or you get it in a Medicare Advantage.
okay.
Hmm.
All right. So what we're
One
really
or the other.
So we're really not shopping Medicare. We're shopping the other two, the supplement.
That's correct.
And those prices could vary based on needs.
Right. Well, you're shopping your Medicare Advantage and your Part D.
Okay.
And those vary based off of what I want to stress here is your prescription drugs, so the drugs that you take, the cost of those drugs, and they have to be covered by the insurance company that you have. So that is one way that they are priced. And then the Medicare Advantage also covers your health, your doctors. So you want to make sure your providers stay in network and you know what the full cost of it costs to go to the doctors or the hospital or getting tests. So you want to look at the drug costs and make sure your drugs are covered, and then you want to look at your total cost for your Medicare Advantage health insurance. Our supplemental insurance that works with Red, White, and Blue Medicare, we don't change that because that does not change. That coverage will always be the same. It's the prescription drug insurance, the Medicare Advantage insurance, that coverage can change from year to year. Not just cost, but what it covers can change from year to year too.
Okay. So that actually did happen to me. Yeah. And I was really kind of like, really? So one of the medications, not that I use, a family member was using, was a new drug. Yeah. Okay, new test drug. Okay, and it's something crazy like $5,000 a month. Okay, and of course, because I have assets and I have a few bucks, I had to, you're going to pay it. And then we changed it last year. A gentleman came to me and said, Suzanne, let's change this to another company. And I was shocked at the difference and the savings that I made from another company. That's right. Why is that? It was a lot. It was a lot. How is it that one company can be so favorable in the patient's corner and the other one, the prices are outrageous? It's ridiculous.
They negotiate the prices. So we always hear that, right? How they negotiate prescription drug insurance prices or prescription drugs. Oops, I think we got a delay. So yeah, they negotiate the pricing with the manufacturers. Each of these insurance companies negotiate the prices with the manufacturers. So you have to find the insurance company that covers the manufacturing of the drug that you want.
Wow. So to my fellow Lupians, because a lot of us take a lot of medications. I'm one. I take like 27 pills a day. Okay. Not all different. Okay. I'm not a drug addict. It's just I have multiple. When you have lupus, you have multiple. It's not unusual to have multiple illnesses or diseases. Okay. You get their brothers and sisters. All right. And of course, there's no cure for any of them, so we treat the symptoms. So a lot of medications. But my formula works. But the cost is expensive. The cost to have lupus is expensive in more ways than you can imagine. Okay, living with the disease and, of course, the medical and the drugs and everything else. So if you have a lot of medications, and as we get older, it seems like there's even more added on to them, do shop that around because it is a tremendous savings. I had no clue. I was paying a ridiculous amount of money. And I don't know, God sent me this little angel from an insurance company who said, hey, let's look at this. I thought, why? Why would it be different? Meantime, it was different, a substantial difference.
And next year it's going to be even more important because there is a $2,000 maximum out of pocket on what you'll spend in a calendar year on prescriptions. But those prescriptions need to be covered by your insurance. So to get that benefit, to get that maximum $2,000 spending, so you say, I don't know what you spend a month on copays, but this would be an annual copays of no more than $2,000. To get that benefit, you must make sure the prescriptions are on your plan's formulary. So it's going to be even more important next year.
Very important then. That's very, very important. And who can help a patient navigate? Is that something you can help navigate a patient with?
You bet.
Well, then
Our OSHIP hotline can do that, because what we use is the Medicare.gov website, which is the federal website that has all the information. So if they call us with their prescription drugs, the dosage and the frequency, we can assist with that.
Wow. This is, it happened to me, it just, and I was just dumb about how all of this really works. And, at this time of year, we get inundated. I was getting so many calls about Medicare, so many emails. It's like, what are these people trying to do? And, of course, I got age fast. I don't know how I got there that fast because I was just so busy. Okay, but it was like, but what a substantial savings between myself and my husband. I mean, my out-of-pocket last year was something crazy, like $87,000. It was ridiculous.
That's ridiculous,
right? It's ridiculous. Yeah. And the savings by switching over, I'm just blown away. Just totally blown away.
There's a national article I just saw before open enrollment. 70% of the Medicare beneficiaries do not compare during open enrollment. I have been doing this for almost 20 years, and every time we tell people you need to compare, even if you're happy with the plan that you have or you think it's working fine, you just don't know what else is possible out there. And so to think that 70% of the population doesn't switch, I often think that's why insurance companies can do what they do, right? By making so many changes, because they know you're not paying attention.
We're not paying attention. We're not paying attention. And I think the senior population especially isn't paying attention, because even though, even still working, I have generational issues. I have people here that are 20-year-old, 30-year-old, 40-year-old, 50-year-old, 60-year-old. We've got one of each here, okay? Yeah. And we all react to things differently. But for those of us that are aging, a lot that are retired and have stayed home for the last 10 years, technology is not their friend. It is not their friend, okay? They didn't keep up with it. They put their pajamas, they're working around the house. For most of them, they're getting by, and technology is not their friend. Right. And to go online and look at this, they're going to say, online, what? What do you want me to do, what? Right. And it is, I keep using the word ignorance, and it's so harsh, but it's the truth. It's the truth. I think there needs, with that booklet, when it comes out, should be a red piece of paper in there and says, check the prices on your medicine. Because if you don't take medicine, a lot of medicine, it's not a big deal. Okay.
Oh, it still can be. I'm gonna say differently. Even if you don't take medicine, you want to make sure you're still in an appropriate plan, because some people are paying for something they're not actually potentially using yet. So there's that option too. It's still insurance. It'll be there when you need it, but there are less expensive options depending on the types of drugs that you take or no drugs that you take.
I wonder how many people read that big book. So that big book came 2 weeks ago, okay? And I thought, what is this? No, it is a big read. It's too big. Shorten it up. We're not going to get our noses in there. I'd love to take a poll to see who really reads that.
We used to have somebody work for us who said, that's in your Medicare and You book. You just read it.
Who reads it? Well, I'm still working, so I wouldn't do it. But maybe people are retired at home. Right. I hope they're out having fun, not reading that book. But at the end of the day, we do bear a responsibility. It's our money. That's true. Okay, so
and it's your health.
It's our money. It's our health. Mm-hmm. I just didn't get it. I was too busy to pay attention.
People need to be proactive. That goes back to my first message, making sure that if you have Medicare, know how you get your Medicare, and then tell somebody that also assists you as well.
So if my one drug is $5,000, and a lot of folks with lupus are on biologics now, which are very expensive, okay? And so what we need to do is, one, look at your drug plan and find out if that drug, so if it's covered now, will it be covered tomorrow?
Well,
how do we know?
It'll be covered if it's covered today, it may not be covered next year. So you do want to make sure it's on next year's formulary. If it's covered today, it will be covered tomorrow. If they're going to make a change, they have to give you notice, and generally it's a 60 to 90-day notice. But if they've already filled it for you, so if you got it in March, right?
Mm-hmm.
And they send a notice in August or send a notice today saying we're not covering this drug for the remainder of the year, it's only for new people, not for people who are currently on it. But if it's not covered next year, then that's where you have to go to another company that does cover it or file an appeal to get it covered if you're not going to.
So
that is their notice to tell you that, we covered this drug. We're not going to cover it next year. It's Medicare open enrollment, so that is their notice to you to say, be responsible, be proactive, find another insurance that will cover it.
Are they going to call me or send me a letter?
They're going to send you a letter.
Okay, so pay attention
and they're
to
not
the mail.
necessarily going to send you a letter directly about you. It's going to be for everybody. So you have to pay attention to those kinds of letters. And I know you get so much mail, but back to the message, if I know what I have and who I get it from, right, that insurance company, those are the letters I want to pay attention to.
Okay, so we're in mid-October now, all right,
Mm-hmm.
and these changes are effective in January.
January
so 1. I'm going to call the company that is handling that medication right now. And will they tell me on the phone if it's going to be covered in January?
Yes. Yeah.
Okay.
If you call your company directly, they should tell you if that drug is on their formulary for next year and at what cost.
So they do have that list now. They
yes.
are up to date now.
They are up to date now. That's correct.
Okay.
October 1st actually is when they updated them.
All right. So this new benefit or discount they're going to get. Tell me about that. How did that come to fruition? And are there going to be any hiccups with that, or is it going to be smooth sailing?
So it was created in the law because Medicare is in law. So in 2003, they passed the Inflation Reduction Act that did a lot of other things, but some of the things in the Inflation Reduction Act changed Medicare law. So what it started doing is where we got the $35 insulin price per month. So that happened in 2023. People's insulin for diabetes, covered insulin, was $35 a month. This year we got out of the catastrophic level. So if somebody fell into, we used to have something in Part D called donut hole and all of that. Mm-hmm. This year, if they got to that catastrophic level where once you had to pay 5%, everything was covered at 100%. So you should have stayed in about the $55,000 to $8,000 range on drugs for this year. So if somebody is in the $87,000 range on prescriptions and have Part D in 2024, it tells me that your prescriptions were not on your formulary because there was a cap, but that cap this year was about $8,800. So what they also established is getting rid of that cap and that donut hole that created this maximum out of pocket for prescription drugs. This is going to fluctuate from year to year, but it's $2,000. That's where the $2,000 cap is for 2025. So there's no more swinging up and down, low at the beginning, high in the middle, and low at the end. It's all... It's $2,000 max. You can spread it out through the whole year if you wanted to. You could schedule a payment plan with your Part D and spread that out for the calendar year, or you can just pay it, If you reach $2,000 in the first month or the first quarter, you just spend that on copays, and the rest of the year your costs are zero. So it was created in the law. Will there be hiccups?
I feel like I'm going to get a raise. Because of the savings.
It is a good savings. But again, I think the hiccup lies in the formulary, people really need to pay attention to the formulary, the list of covered drugs. There's no changes. I mean, the plans still have to cover a very large list of drugs, 2 of every category. But I think they're going to be a bit more, they're going to even review those even more closely. So I think that could be the hiccup where people don't realize that the drug that they take is not actually covered by their plan, if that makes sense.
Okay,
because
so
we've
they
gotten
can
lazy about that.
They could remove the drug that I'm working, the very expensive one that I'm challenged with. They could remove that from my plan, right?
They could, but they have to have an equivalent, okay? But then you can also have a doctor, you can write an exception as well, file for an exception, especially if you've been taking that medicine a very long time and it's the only one that works. So you can always file exceptions to get it covered as well. So maybe the hiccup will be that they'll make people do more exceptions.
So I
don't know if that's a total
I can't celebrate yet until I check this out. I have to I have to dig deeper.
I want you to contact me when you do hit that 2,000 next year, and it's all zero, and you'll say, Becky, guess what? It is April, May, June, whatever it might be. Yeah. You are right. It's 2,000. And I say that because last year we did have some folks who noticed the maximum spent last year and kept saying, it's still zero. My drugs are still covered. And every month they'd say, it's still covered at 100%. I reached that max because they have very high drug costs, right? So they met that maximum. And they kept checking in to say, it's still zero. I still am not paying anymore. It's done. So
I thought something was wrong. It was like, and then they call because it's a specialty drug, and they call. And they go, this is a Cleveland Clinic. And the one time they said that it wasn't approved anymore. It's like, what? Because it was in the middle of the year. Here, it just needed to have a rewrite. Yeah. The doctor had to push it back out.
That's sometimes it has to be. Sometimes, remember, it's still managed care. And when it comes to managed care, they still require some kind of prior auth or step therapy or something.
Okay, so we do know that it is a very political arena out there. And in January, we're going to have new leadership. Can they change this on us, or it's okay, we're safe? You're going.
Can they change it? Again, it's a law. They can't, I mean, to make any changes, they have to change a law. They can't even, I don't believe they can even change things with executive orders with Medicare. As I said, the 20 years I've done it, I've not seen executive orders. Now, I do know when the Inflation Reduction Act was passed, so that was passed in August of 2022, the changes for they did make changes for 2023, which is very rare. Usually when they make changes for Medicare, it's down the road because they have to change policy to get there. They pushed out those insulin into 2023, but again, it was in the law, and they had to scramble fast to get that fixed because there are things in the law that plans have to do, so that they did have to put in a law an exception for that insulin.
There's always these rogue rumors out there from all political sides.
All sides.
It's just crazy polarization out there right now. But rumors of no more Social Security, no more Medicare. We're going to get rid of it. They can't get rid of it. Right.
Somebody said that to me last night at my talk, and I said I had heard yesterday there's over 66 million people on Medicare. If I was a politician, that would be really stupid of me, right?
That's
60. Yeah, exactly. And that's not even counting the amount of people who are in Social Security without Medicare. So that's a large amount of people. The program itself, it's been around since what are we at? 60 years? 50 years? 65 it started, so we're almost over 50 years on Medicare. Social Security's been around since the 30s, so yeah.
Wow. All right,
and again, it's a law, and it's paid by taxes.
We all pay our share of that too. All right, so the news is that you should read the book.
Read the book. Well,
read
you should
the
read
book.
not the book. You can read what I want you to read. First of all, what I want you to do is, what are the cards in your wallet that you use for health insurance? So that's the first one. The second one is, once you know that, then you're looking for your annual notice of change from your Medicare plan. And it'll say that in here. This is an annual notice of change. This is what it's going to look like. That's what you're looking for.
Okay.
And so that's what you want to review first. Most of the other stuff you're getting in the mail, the marketing material, that's not stuff you really need to pay attention to. The phone numbers, the people calling you, I wish I could block them.
Yeah.
But, you can't.
It's just what is going on with these people? They're annoying gnats,
They are. They are.
But wow, we need to pay attention. So, all right, you're going to get this little book.
And then share it with somebody.
And Becky, is your phone number in the book? What's your phone number? How can someone reach out to you or your team here in Ohio?
1-800-686-1578. And yes, it's in the book. Right on the back of the book it says, call this number for free personalized health insurance counseling. And it says right here, SHIP for Ohio. Ohio Senior Health Insurance Information Program, OSHIIP, 1-800-686-1578. You can't see that very well.
There it is.
It's on the back of your book.
It's
right
better.
on the back of your book.
Okay, look at your cards, pay attention, especially your prescription drugs. That's that's the impact here. You could have a better year than last year due to the changes. There's looking at a $2,000 ceiling. That's what my understanding is. You have to make sure
covered drugs.
You got to make sure that your drugs are covered. If not, call Becky. Okay, and she'll help you find. You're going to help her. You're going to help OSHIIP. I just hear everybody calling OSHIIP and go, "Hey, where's Becky?" It's
right,
okay.
Exactly. I don't need that.
Keep you busy. But someone can, reach out, and if you have questions, you don't have to do this journey by yourself. And as always, here at the foundation, the staff is happy to help in any way we can if you need some help. We do have wonderful Rita, our head patient navigator here, who can help you with this incredible journey. But this is good news. I mean, the half glass empty, half glass full. If we have to take medicines, thankfully these medicines are available, because I can tell you it's taken decades to get some of these medicines through the FDA. And I'm just, I honestly, Becky, you don't know me well enough, you don't know my story, but I'm shocked that I've lived this long to see the fruition. Okay. I was hoping for a cure by now, but we do have better treatments. We have more treatments, we have better treatments, and people are being diagnosed a lot quicker than before with lupus. So this is all good stuff in the light of things. In the light of the storm, there is light. How's that? And Becky, I thank you for taking the time and such short notice too. And I apologize for any technical issues we have. And this happened to me, so I'm happy that you clarify things and remind me of my own self-management and responsibility. And if I'm gonna work, I better make sure I spend my money wisely, and it'll go a lot further. So thank you for your time, and thank you everyone for visiting my Lupus Living Room here in Ohio. And as always, you don't have to be on this journey by yourself. You can call 1-888-NO-LUPUS here at the chapter office in Ohio, and we're happy to help navigate your journey. I invite you to participate in support groups, educational programs, and know that we have patient navigators standing by to assist you in any barriers to care. Becky, thank you again. And as always, your doctor is the best resource to tell you about treatment and your medications, and we're just here for information and for sharing and caring. You all take care. Thank you again. Bye-bye.
Bye-bye.
Remember, there is no I in lupus, but there is an us. Until next time, this has been my Lupus Living Room with the Lupus Foundation of America's Great Ohio Chapter. For more information and resources to help you in your lupus journey, please visit lupusgreatohio.org or call 1-888-NO-LUPUS. The funding for my Lupus Living Room is an earmark from the state of Ohio and managed by the Ohio Department of Health. Your physician is the best person to help you in the treatment of lupus. The information you learn here today can be discussed with your doctor, as your physician knows your medical history best. Please do not make any medical changes without consulting your physician first. As with any treatment, stay educated and get information from trusted sources.